Hello, I'm John Baghdadi. My project is Diagnostic Stewardship of Multiplex Molecular Panel Tests to Improve Antibiotic Use. My mentor is Dan Morgan. The problem we're hoping to address is that antibiotics cause adverse events, resistance, and C. diff infections. Antimicrobial stewardship is the main way we push back against unnecessary antibiotic use, but it's difficult, labor-intensive, and time-consuming. At the same time that this project seeks to address a problem, it's also designed to fill a gap in what's known. Multiplex molecular panels for respiratory and GI pathogens only entered common clinical use in the last 5 years or so. These are rapid molecular tests with a short turnaround time and high sensitivity that make them much easier to use than bacterial culture. But along with these advantages is an increased likelihood that multiplex panels will produce clinical false positives. Ideally, multiplex panels could reduce unnecessary antibiotic use by facilitating early diagnosis of viral illness, but unfortunately, development and implementation of these tests has outpaced the evidence, so the best way to deploy them in clinical practice remains unknown. Our hypothesis is that at present, multiplex panel testing is frequently performed in low-yield situations in which it's unlikely to change clinical management. The proposed solution is diagnostic stewardship, which is a category of interventions that change the way tests are ordered, processed, and reported so that the data generated from testing is more useful clinically. The benefit of diagnostic stewardship is that it can be hardwired into the electronic health record, making it more sustainable. The three aims of this project are, first, to characterize current practices for diagnostic stewardship of multiplex panels across the SHEA Research Network. Second, to identify, develop, and refine diagnostic stewardship interventions to enhance their acceptability among frontline clinicians. And finally, to do a pilot study. Briefly, the methods to accomplish these aims will include a survey, qualitative sessions, and an implementation project. The online survey will address perceived patterns of misuse and overuse of multiplex panels, perspectives and experiences to support best use, and strategies on how we can improve testing. Responses will be analyzed using pile sorting, which is a qualitative methodology in which answers are printed out on slips of paper and sorted into categories. Next, interventions identified from the literature or survey responses will be developed and refined in one-on-one sessions with frontline clinicians. In these sessions, clinicians will provide feedback through usability testing, and this feedback will then directly inform iterative revision of each diagnostic stewardship intervention. Finally, once the interventions have been refined, we will implement at least one intervention at the 2 campuses of the University of Maryland Medical Center. Evaluation will include tracking safety outcomes such as mortality, readmission, hospital onset bacteremia, and C. diff, as well as antibiotic use metrics. To support feasibility, outcome measures will rely on data elements that are already collected by infection prevention and the Department of Quality so that no chart review is required. In terms of deliverables, by the end of this study, we hope to be able to share a menu of diagnostic stewardship interventions across the SHEA Research Network. If the pilot is successful, we also hope to extend study interventions across the University of Maryland Medical System to other system hospitals. And the data generated throughout this project will serve as preliminary data for my own career development award applications. When considering feasibility, the main selling point is that I have excellent mentors who have extensive experience working with the SHEA Research Network and in qualitative research methods. As for the budget, we are requesting a small amount of money for survey incentives and support for a research assistant. Realistically, the timeline for this project should take 2 years, including the pilot. The academic environment for this project is the University of Maryland School of Medicine, with support from my phenomenal mentors, Drs. Dan Morgan and Anthony Harris. So that's all. Thank you for your time, and I'll see you at SHEA.